Oh no, I'm too close. Anyway, guys, I think it's been a long time since I go live here on my YouTube channel, and I honestly don't know how I'm gonna be very informative in this type of setup. Usually, when you do updates or well, as for me, I feel like it's gonna be more effective. It's if it is a recorded video, but I just want to talk right now my in my place where I'm at. Wait, I need to charge my phone as well. But anyway, this is just gonna be a short one. But in my place, it's already midnight, and I'm having my midnight snack. And while I am eating, I am going to tell you the updates of my braces. Braces at 72. I think it's been months and months. I think the last time I updated you guys was 4 months into the treatment. I am now currently at 15th month, and I feel like I wanted to do this because I thought that I'm gonna take my braces off today. I just had my dental appointment earlier in the afternoon, and then I was told months ago that my braces are gonna be removed in January. So I was so excited for this day to come because I'm gonna be free with these metals inside my mouth. But then I did notice, and I'm actually surprised when she told me that my braces is gonna be off in January. I don't wanna be messy, but months ago I was surprised back then, but I did not say anything because she's the dentist. She knows what she's doing supposedly, and I thought that maybe because I am done with my payment, and she's one of those dentists. I'm sorry to be thinking this way, but I'm also just happy enough with the effects on my teeth. I rarely have bruxism. Well, rarely grind my teeth in my sleep, or I do some um, teeth clenching. I rarely do that anymore. But I did notice that this is gonna be embarrassing, but I did notice that it is more common for me now to have like saliva during my sleep. So I before I had my braces, it doesn't happen, but I think maybe it's because of stuff like this, or maybe not. We don't know. Well, we're gonna be seeing, or I can update you with that after this braces takes off. No, it's not gonna take off on its own. After I get rid of these braces, that's what I'm saying. But anyway, um, on the 15th month, she told me that my teeth is already aligned, so we can do the finishing or the finalizing in February. And supposedly, I don't know how long it's gonna be um, on that stage, but I did look at some videos about braces in the finalization stage, and that is when there are elastics on this side of your. I still can't pronounce the S right. I mean, I think I can still hear my lisp, but I it's not the worst. I know. It's just that I know that there's still something wrong with the position of my teeth, and I still don't have a bite. That is what I am getting at. And so when she told me earlier that because she's asking me what color I wanted for my elastic, and I told her that I thought we were gonna take it off today, but she said that if she was actually surprised and shocked that um, I am asking her to remove my braces, when in fact she was the one who told me that months and months ago. I think that was back in October or September. I think it's back in October, and then she said that it's for the year my last appointment with her will be in November, and then I won't be returning until the next year of January, where we will be taking off my um, braces. And so I was so excited for 3 months and that I'll be getting this off, but fortunately and unfortunately, it's still here to stay. um, and what else? What else do I want to talk about? Well, anyway, as I mentioned, I still don't have a bite. She said that my teeth is still open. I mean, if these are the upper and lower part of my um, jaw, my teeth is still like this. It is perfectly U-shaped now. Not that perfect though, but it's U-shaped now, and all of my teeth are straight. My teeth alignment is also corrected, so it's effortlessly um the same. I mean, it's effortlessly aligned now because before I even try to like correct the bite on my own. Like I try to bite in my right side, I think, and yeah, it's now corrected. I saw that because I mean, I just looked at it in the mirror earlier because she said that my alignment is already good, so now we can proceed to the next process. Well, apparently we still have the next process, and I do know that, but I thought that I'm gonna skip that step because my teeth is moving fast, and that's what she's telling me. And she's telling me that my teeth are still moving, so we can't stop the adjustments, and that's what she's telling me. I don't know what that means because I thought that the braces or my teeth will normally move because we have the metals, we have the elastics, and so on. And she's adjusting the thickness of the wire. So I don't exactly know what she's telling me. And she also told me that, yeah, from the last appointment that I had back in November, she did tell me that we are going to like harden the teeth, like it's gonna be so that it's gonna be on its permanent positions, like the shape of it, it's gonna be perfectly U and so on. um and now she's telling me that it's still moving. I don't know what that means, and I don't know how she is actually making that um diagnosis. Of course, she's the dentist. But anyway, guys, so I'm really confused. I try to ask questions. She told me that the time that where I am not, I mean, during December, because as I said, I did mention, I don't have any adjustments or dental appointment back in December, and that was a time for me to rest. And maybe after February, she will assess my teeth if we can go on finalization, maybe, or if we can continue resting it, or we will be resting it after the finalization. So I don't know how long the elastic's gonna be. I know it's a nuisance to have, and I've heard stories from my friends who had braces before me that that is like the the most annoying part of the braces of the of this treatment. I really thought that I can get off with without experiencing that. So I don't know what this feel right now, but I love that she, even though I'm done with my payments, she's still willing to actually correct and really fix my teeth. And I wanted to have a bite, and at the same time, I'm really tired of this. That is why I am in the middle. I'm on the fence whether I want my braces taken off or not. But of course, the professional will be the one to decide. And so, yeah, I don't I don't know if I'm gonna do a monthly update in this channel or not. I may do so if there's something worth talking about. Because to be honest, guys, my treatment has been like very normal. I don't think it's norm. Yeah, I think it's normal. But for me, it's kind of painless. I mentioned in my first story time about my braces. I only have I only experienced the pain for 3 days. Like I can't eat, I can't swallow or chew solid food. I can't use straw. But now every adjustment, every month, I'm doing good with my adjustments. I really try to keep that up because I also have a lot of, I don't know what it's called in English, but I always have like the white, what do you call it? I think I have already. I think I mentioned it before, but now I forgot. Or maybe it's because it's the time of the day, or maybe I just don't know. But anyway, um, so I feel so irritated when my adjustment is almost due. So I kind of like sometimes go to the dentist the day or a few days, a couple of days before the actual appointment day, if I am not busy. And so I am, in terms of that, I feel like it's also because I am following the schedule, so the adjustment has been pretty smooth. There is no drastic changes in terms of my wires and the positions of the elastics. So I think that is one of the tips I can actually tell you, because based on my experience, it's not painful. I also thought that every adjustment would be a painful one, but it's really not. It's been pretty smooth, aside from having singaw almost every month, because when my appointment is almost due, I would most likely have singaw. What else? What tips can I give to people who wanted to have braces? Yeah, maybe just really. Oh yeah, you need to find a toothbrush that works for your teeth, because during the time when I have my braces and my teeth are quite crooked, yeah, still, I can actually use any toothbrush and just use it around and about my entire teeth. But now that my teeth is straight and I feel like it's kind of also very tight already, I find brushes. Those are like baby brushes. It's not the interdental brushes anymore. The one that I showed you in my last braces at 72 video. It's the it's a very cheap, actually it's a very cheap kind of brush for kids, and they have like soft bristles, and I use that to actually brush all of the corners of, I mean, if we have this brackets, all of the corners of the bracket, I need to brush them, because I I can see that there is like what do you call it, like the remains of your food. Maybe let's just call it like that. And I make sure that I brush my teeth every day. Not every meal though, although that's gonna be ideal. But I eat almost every hour. So if I'm going to brush my teeth every single snack that it's not gonna be good for my teeth as well. And and I've read it actually. I've read and seen a few videos and articles about too much brushing. Sometimes, if the food that I ate is really stuck in my teeth, or in between my tooth or my teeth, I would usually just brush it without toothpaste, because the is really going to be harmful with your teeth. And the reason why I feel like it's true is because I'm experiencing that pangingilo feeling Sensodyne. I'm experiencing that pangingilo back when I was too paranoid to smile or even talk when I started having these braces. So I try to brush my teeth every single meal, or sometimes I don't eat, just so there is not gonna be like this social embarrassment. But anyway, yeah, brushes. Go to your dental appointments on time. Find a brush that works for in the phase of your teeth. I mean, we will you will be experiencing different phases of your teeth, like it's gonna be tight, or sometimes you would be needing dental floss. And I did share that as well. I no longer use dental floss this time around because it's too my teeth are also tight already, so it's gonna be difficult. Although I know that I should, it's maybe I will do that when my braces are off, but it's really difficult and it takes a long time, and I'm not getting any. It takes a long time for it. The trick that worked for me is finding that baby toothbrush. The toothbrushes for baby and the cheap ones, because they are really really tiny and thin bristles that you can just get into your teeth, and it will just get rid of all of the anything that is in between there. Anything that the dental floss can get. I mean, I know that dental floss has fluoride in it. So, there are dental floss like that, so it's still good. But what you can do is to also buy a mouthwash that has a fluoride in it. So that is gonna be easier. And just make sure to also um, leave that for a few seconds so that it will get into everywhere around your teeth. Hmm. And I don't know really what else. I have never, in 15 months, I have never had experience a bracket falling off. Earlier, there was a patient who said that she has two braces or brackets off, and I was surprised that there are even two. I mean, what is she eating? So, as for me, I just make sure that if I feel like I can't handle, if I feel like my teeth can't handle the food that I'm eating, I no longer I just don't eat them anymore. Although I still eat biscuits, cookies. I eat chicharron. You know how crispy that is. But there are some parts that are also too, what do you call this? Too hard maybe. I don't try to I just don't bite into it anymore if I can't manage it. I know that ever since I had the braces, there are food that I can no longer eat, or I find it hard to eat it. So I just live with it, and it's just gonna be easier for me as well. And I love food with different textures as well. So I don't really find it difficult to get away with it. And you can still eat it. It's just that overall, when you feel like it's not working, if you feel like you're not biting into it, and it's kind of like difficult with your, I mean, it's hurting your gums, then stop it. Don't eat it. I know it's gonna be delicious, but it's also not gonna be good for you if it's that hard. What else? Maybe I can give you more tips when I have concluded this journey. One interesting fact before I end this is that if you have noticed, I have a receding chin. That is the first. I mean, this is the first time I know what my chin is called. But I have a receding chin, and I feel like part of the reasons why I feel like it's receding more and more is because of my posture, and I'm trying to correct that. And there are exercises online where you need to just, you know, correct your bone structure, so on and so forth. And I'm also having my braces, and I know that this part is also not the best. I mean, this part of my teeth is still um slanted forward, so hopefully that gets corrected in my it gets corrected after my treatment, my braces treatment, as well as this one. I don't really have any problems with this, but I still have, this is, to be honest, very forward, and that is the reason why I have overbite. And as for this case, this really needs to move back a lot, and I hope that gets corrected. I do have like a small chin in here, so I'm kind of also, maybe that's one of the things that I'm convincing myself that it's a good thing that your braces are not yet off this month, maybe a few more months, because you can see how it's gonna correct your facial structure and so on. But I'm also going to continue correcting my posture because I am finding myself sitting quite forward like this when I am playing games. So I am vlogging um, a day in life videos, and I am seeing my posture, and I also see some of videos and photos of mine, and I'm thinking that this has been receding more and more as I age, and that has not been the case. I mean, it doesn't look like that before. So I feel like my posture is something that I really need to fix, and I don't know how else I would be fixing it, because sometimes don't, it's my subconscious, so I don't know exactly how it's gonna be corrected without me even thinking about it. Yeah, I feel like there's a way. I'll be sharing that with you if if and only if um I find a solution. Well, anyway, I will be ending my stream right here. I hope that, I just really want to post an update just also for documentation of this treatment. And I don't have pictures to show. I still take pictures every month with of my teeth, but it's not really that drastic anymore. Especially I'm always just taking a picture in the front of my teeth. I should have taken a picture of my profiles as well, so that we can see the difference. But maybe I'll do that once we have the elastics. It will correct the position of my overbite. So I think that is it. If you are still here, um, if you are still here in my live stream, then you can also try to check out a day with Sakurai. I will be posting like very casual videos in there. I don't really have a format in mind just yet, but maybe I can talk more about my, if you do have questions, you can just leave in the comment section here. But in there, it's just gonna be more casual, so you can ask questions or daily updates or weekly updates or whatsoever update that you want to know about my braces. But yeah, just to conclude, my wish is still here to stay. So I don't know how many more months that I am gonna be living with this metal inside my mouth, but hopefully it's just gonna be 3 to 6 months. I don't want to have this for the entire year of 2023. But yeah, I think that is it. Thank you so much, and I'll see you next time.